Good day, mighty eagles. Welcome to MCNP ISAP. It's great to be with you in this orientation. As you all know, the COVID-19 pandemic has caused significant disruption and hardship in every aspect of our lives. It is greatly affecting our economy as well as our educational system. There is a delay in the schedule of graduations, and board examinations have been postponed several times already. Despite of the devastating impact of COVID-19, life must go on. This too shall pass. We are in the same world like before, but we are facing a different circumstance. So now, our normal has become new normal. On such circumstance, how can we be acting normal to coexist with the virus? The only thing we can do is to act normal with new things and new habits every day, which in the past were only expected from sick people. We are not sick, but we should think that we are to keep ourselves safe and others too. So how exactly should we behave to adapt to this circumstance called new normal? What we enjoyed in the past has become a luxury. We used to breathe freely, never minding how close people are to us. Before, the closer we are to people, the more secure we are. Today, the closer we get physically, our health security is at risk. That's what we call the irony of the new normal. We can no longer do at present what we used to do in the past. I understand that we will be having a hard time to adjust with the new normal protocols in school. But as we move forward and practice it every day, then eventually adaptability to it becomes an ordinary thing. We might not even notice it because this will already become a part of our system. What matters is presence of mind. Let us all be mindful, conscious, and cautious of everything that we do to prevent us from getting sick of COVID-19. We need to learn how to coexist with the virus. Let me start with the basic principles. Following basic principles can help keep students and employees safe at school and help stop the spread of the disease. So here are the guidelines for entry in the school campus. School personnel are assigned at the entrance gate to take the body temperature of all who are coming in the campus for any purpose. Those with private vehicles shall abide by the policy before entering the campus. Everybody is required to register in the Health Guard PH contact tracing system to secure HG code and QR code. Before entering the campus, the QR code will be scanned in the scanner placed at the entrance gate. This is for the purpose of contact tracing. So perhaps you can already start registering in the Health Guard PH contact tracing system. Next, sanitation of hands is strictly observed, and alcohol dispensers are available at the entrance gate. Wearing of face mask and face shield as personal protective equipment is mandatory. Social distancing will be strictly implemented. Those who are considered suspect with COVID-19 related signs and symptoms like colds, fever, and cough will not be allowed to enter the campus. Instead, Health instructions will be advised from the school personnel on duty. So here are the non-pharmaceutical interventions to avoid becoming a courier. Everyday preventive actions that can help students and employees from getting sick and or spreading the virus. Number 1, staying home when sick or not feeling well. So employees and students will not come to school if with any of the following signs and symptoms: dry cough, fever of temperature 37.6 degrees Celsius and above, difficulty of breathing, colds, sore throat and difficulty in swallowing, headache, body ache, dizziness and body weakness, and diarrhea. So here are the actions to be taken. First, inform immediately immediate superior for employees and class advisor for students. Class advisors must strictly monitor attendance of students. Know the reason why a student did not come to class if not informed. Seek medical consultation. If admitted, inform immediate superior for employees and class advisor for students. Once recovered, you have to present medical certificate for consultation or confinement and other pertinent results of laboratory examinations done. Do not come to school if with known direct exposure to a probable or confirmed case. What is direct exposure? So direct exposure is face-to-face contact with a probable or confirmed case within 1 meter and for at least 15 minutes. Direct physical contact with a probable or confirmed case. Direct care for a patient with probable or confirmed COVID-19 disease without using recommended PPE. So PPE is personal protective equipment. And other situation as indicated by local risk assessments. So what are you going to do before going to school or before coming to school or before coming for work? First, avoid wearing jewelry, metal watch, and other non-essential accessories because the virus can stay for up to 72 hours in metals. Tie hair if it is long. So why? Kasi pag hindi yan nakatali, pag nakalugay lang yan, so tendency, yung buhok pupunta-punta sa mukha, tapos syempre natatouch mo na yung face, which is not supposed to be, especially if your hands are dirty. If admitted, inform immediate superior for employees and class advisor for students. Wear short-sleeve blouse or shirt, pants, and closed shoes. While in school premises, employees and students are required to let the temperature be checked at the entrance gate, wear face mask and face shield at all times, and avoid touching the inner part of the mask unnecessarily. If mask is removed and have the urge to sneeze or cough, cover mouth with a handkerchief or cover it with the upper part of the arm if a handkerchief is not available. So it must be this way. Bring on hygiene kit with contents of alcohol, hand sanitizer, tissue, soap, and extra face mask. So this is actually mandatory. Your subject teacher will check this soon. For employees, sanitize hands before and after using biometric scanners. Wash hands often with soap and water for at least 20 seconds. Maintain social distancing at all times, observing 2 meters or 6 feet. Avoid touching face, especially the eyes, the nose, and the mouth, because these are the portal of entries of the microorganisms, especially if your hands are dirty. Avoid using mobile phone unnecessarily, and never allow others to use your phone, especially for calls. If in case pinahiram ang cellphone, so isanitize mo muna ng alcohol bago mo ulit gamitin. Be wary of frequently touched items like doorknobs, pens, notebooks, books, etc. So never lend your personal belongings to your classmates or to anyone. Push doors using feet, elbow, or shoulder. Or yung doorknob, since you have an alcohol with you, to be safe, isprayan nyo muna bago nyo bubuksan yung pintuan. Don't touch anything with your hands if you don't absolutely need to. Avoid sharing of utensils and food, lalo na yung mga chichirya. Avoid hugs and close greetings. Avoid unnecessary group discussions. Use upper arm or back of hand to rub face if itchy. So, ganito lang. Okay? Name tags of students will be pasted in their respective chairs. Hence, sitting assignment shall be strictly followed. Faculties are prohibited to loiter from one office to another. So you are also prohibited to loiter from one classroom to another. Faculty transactions are through online and use of mobile phones. Avoid loitering in the campus. Distribute office correspondence through email. So lahat na kami ngayon is paperless. So puro email na lahat. So while in the dormitory or residence, so this is very important because some of you or majority of you will be staying in the dormitory. No hugs and close greetings. Remove school shoes and leave it outside the door. It would be better if isprayan nyo pa yung sapatos nyo sa talampakan at sa yung upper part niya. A disinfectant must be available outside the door to disinfect bag, face shield, and other stuffs. A hamper must be available outside the door for soiled uniforms. So mas maganda pa kung pagkatanggal mo, labhan mo na agad kesa ma-stuck sa hamper. Observe personal hygiene. Take a bath immediately after coming from school. Short fingernails must always be observed. Do not go out unnecessarily when you are already inside your boarding houses, dormitory, or residences. Maintain social distancing, especially in boarding houses or dormitories. Sanitation. So, proper disposal of used tissue paper, proper disposal of face mask and face shield. So, ang face shield naman, itatapon mo na lang yan kung talaga namang sobrang dami na ng scratches. Pero dapat, ang face shield, pagdating mo sa bahay o pagdating sa dormitory, hugasan mo ng maligamgam na tubig with soap. Okay, para magamit mo ulit the following day. Ang face mask naman, pag tinapon mo yan, dapat i-fold mo siya paloob, tapos i-roll, itali, balutan ng tissue bago itapon. Ensure trash is removed daily and disposed of safely. No spitting policy in open learning areas. Daily disinfection of frequently touched surfaces like doorknobs, railings, window handles, tables, and chairs. Provision of infectious garbage in conspicuous areas in the campus, ensure cleanliness of restrooms with available water at all times. So, there is available water at all times. Meron ding mga alcohol dispensers sa mga comfort rooms. Ensure soap and safe water is available in hand washing stations. So, we have hand washing stations scattered in the campus. Place hand sanitizers in restrooms, classrooms, and halls if possible. So we will do that. Clean and disinfect classrooms and offices as the need arises. So policies in social gatherings. Limited school gathering to maximum of 10 participants in every activity. Public conduct of the following shall be temporarily suspended until further notice: flag ceremony, faculty and student assembly, mass orientation of students and parents, holding of meetings in closed spaces. So lahat na to is done virtually through Zoom meetings. Use of gymnasium for rehearsal and sports activities, conduct of intramurals and foundation celebrations, special programs like Discovery Weekend, Friendship Camp, Camp of Colors, and Success Plus. So lahat, puro Zoom na lahat. So here are the quarantine protocols. So when an employee or student has COVID-19 related signs and symptoms, after thorough nursing health history, medical assessment, and carrying out of physician's orders, the patient will be brought immediately in the quarantine facility. The school nurse on duty immediately informs parents and or guardians. Consent of parents for the transport of the student in the hospital has been pre-signed and submitted in the Health Services Office for filing. But then when I attended a contact tracing seminar, DOH said that if a student has COVID-related signs and symptoms, or let's say may direct exposure tapos may manifestation, ang gagawin kung ang bata ay hindi taga Tugigaraw or taga Peña Blanca, itatawag sa respective municipality. So therefore, hindi siya dadalhin sa CVMC or RPGMC. So, kukunin siya ng ambulansya kung saan municipality siya nakatira. So, ito lang, in cases of emergency, school nurse calls up CVMC or RPGMC for patient's transport. Hence, patient will not stay long in the quarantine unit. Once the patient was transported, the room will be disinfected immediately by person in charge following the protocol set forth by the General Services Office. So let me just give you information about the COVID-19 vaccines. So the COVID-19 vaccination's main goal is, the main goal of vaccination is not for you to get infected, but to tame the virus, to reduce serious complications, prevent death and hospitalization. No COVID-19 vaccine is better than the other. Sabi nga, whatever is available is the best. So, can I get vaccinated? So, sino ang mga mabakunahan? Healthcare workers, or the frontliners, A1 ang mga to. Elderly, A2. People with comorbidities, A3. Healthy individuals, pregnant or breastfeeding. Ang A3 may mga comorbidity, A3, and then A4, mga employees, A5. So, parang A5 yata for students. If you are unsure of your current condition, seek for your doctor's opinion about COVID-19 vaccination. Immunocompromised individuals must seek their doctor's opinion about COVID vaccination. So who are these immunocompromised individuals? So ito yung weakened ang immune system nila, like patients with cancer, patients with HIV or AIDS. Common side effects: pain on injection site, redness or swelling, tiredness, headache, muscle pain, fever, and nausea. Nausea is nasusuka. Side effects after vaccination means that your immune system is responding to the vaccine injected. Side effects of second dose may be more intense than the ones you experience after your first dose. Not having any side effects though after vaccination does not mean your body is not responding. What to do if you are experiencing vaccine side effects? To reduce discomfort from fever, drink plenty of fluids and take paracetamol. To reduce pain and discomfort, apply cold compress over the area. It is not recommended to take any medications before vaccination for the purpose of trying to prevent the side effects. When to see a doctor? Severe allergic reaction, redness and swelling gets worse after 24 hours. Side effects does not go away after a few days. Are the vaccines safe and effective? COVID-19 vaccines are safe and effective. It underwent a rigorous multi-stage testing processes, including at least 3 phases of human clinical trials, meaning it has been tested in more than 100,000 of people. What are the benefits of vaccination? Help your body produce immunity against COVID-19, reduce the risk of developing illness and its complications, to protect yourself from getting hospitalized and dying, and to protect people around you from getting infected from the disease, or you are less likely to infect someone. There is still a small chance for you to get COVID-19 after vaccination. But the good news is all vaccines prevent hospitalization and death. So no one is safe until everyone is safe. For the information of everyone, you can still seek medical and dental consultation online. Consultation forms will be posted in the MCNP ESAP FB page. If in case you have health concerns, just fill out the form and send it through our official email at Health Services Office at mcnp.edu.ph for MCNP students, and Health Services Office at esap.edu.ph for ESAP students. Also, all first-year students will have to submit themselves for online dental examination. The dental examination form with instructions will be posted in our page later. Let me end with this quote: "To keep the body in good health is a duty. Otherwise, we shall not be able to keep our mind strong and clear." So that would be all, my dear students. Thank you, God bless, and keep safe, everyone.